Hello, my name is Gavin Boyle and I'm the Chief Executive here at Chesterfield Royal Hospital. You know, I often describe the hospital as being on a journey to become really a model district general hospital, providing good quality care for our patients, services which are safe and sustainable, but also trying to make the Royal a great place to work for staff as well. But these are challenging times. We all know that demand for services is rising, and we also know that the resources available to us as a hospital and as an NHS are tight. So my approach to this really is to keep improving quality as our organising principle. And I'll give you a great example of that. One of the most important things we do as a hospital is to provide emergency care for urgent patients when they really need it. And this is something that we've really focused on over the last few years to try and make it better, but also make it more efficient too. So, for example, we've increased the number of senior medical staff who are available to assess patients, particularly out of hours and at weekends. We've improved staffing levels across the hospital to make sure patients get really good care if they're an inpatient. And we've also made some of our services more available over weekends. So, for example, access to therapy services and access to diagnostic tests and images are more available over the 7-day period. And what that's helped us to do is to reduce the length of stay for patients, so the amount of time patients stay in hospital, and that's good for patients because it means that particularly for frail and elderly patients, they're more likely to return home after their treatment. It also means they spend less time in the hospital and are therefore less exposed to risk. So it's good from a quality perspective, but also by reducing length of stay, it means that we need to deploy fewer beds, and that also makes us more efficient as a hospital. So it's a great example of how you can improve care and become more efficient at the same time. I'm really pleased to be part of the Celebrating Success event today because I've given just one example of the sorts of things that are happening across the hospital, but there are so many more where together we're working to improve the service we offer, make the Royal a great place to come if you're a patient, but also to make the Royal a great place to work too.
Here at the Neonatal Unit, we're constantly striving to ensure we give our families high quality care. It's really important to have a culture of believing that there's always a better way to providing care, looking at our processes and improving quality, delivery and efficiency. Some premature babies are on the unit purely because they haven't yet established their feeding and are requiring some nasogastric tube feeds. We are currently looking at implementing an early supported discharge package which will provide support and training to parents enabling their baby to go home tube fed, and we will continue to provide support for the families in their own home. The benefits we foresee will be the improvement of family-centred care, reduction of length of stay within the hospital, which we feel will lead to emotional benefits for the whole family. These benefits encompass our aims of continuing to improve quality, delivery and efficient care.
Hi, I'm Nikki Hill, Director of Workforce and OD at the Royal. And over the past year we've been working really hard to try and get staff more involved with making the Royal a better place to work and more importantly a better place for patients to receive their care. We've introduced a local staff survey which is giving us really good feedback from staff on what needs to be better and how we can help them. We've also introduced our Let's Talk Care sessions, which is an opportunity to talk with every member of staff about what it is we're trying to achieve and our core values, our Proud to Care values. Again, this is giving us really insightful feedback on what sometimes gets in the way of delivering a great service for patients, and we've started to address some of these issues. Particularly from a people point of view, we know some of our processes make life hard sometimes, so we've done a full review of the recruitment process, and our aim is to take weeks off the time that it takes to recruit someone to join your teams. That can only help everybody and make life easier for everybody and get people on board into the hospital more quickly. We're also looking at how easy it is to access training. We know sometimes it's hard for people to be released for training, so we're looking at different ways of delivering that training. More on the ward or in departments on the job, but also through things like e-learning, which are easy to access and actually can deliver training more efficiently and effectively to people. So there's lots going on, and the event today is really all about trying to celebrate the things that we've been doing to make this a better hospital, both for patients and for staff. So I hope you enjoy looking round at the great stuff that's going on here, because all our teams are working really hard to make this great.
Hi, my name's Steve, Director of Finance and Contracting here at Chesterfield Royal. I've been here since February this year, so still a new person to the organisation. I'd like to just talk a few minutes about efficiency and the transformation agenda that we've got here in Chesterfield Royal. It's really important that we focus on patient care, and I'm sure you've heard of the Royal Triangle. So I'm a real firm believer in improving quality, which will ultimately give us an efficiency saving and make a better experience for the patients. So I think it's really important that we work together, we focus on efficiency, we focus on the right thing for patients, and at the end of the day, hopefully that will make a saving to the organisation as well, because we're doing the right thing for the patients, making sure that we do everything we possibly can to improve their patient experience. We've got a long journey to go in terms of patient experience and the efficiency agenda. Every year we'll have to make 4% efficiency. And so it's a really long-term venture that we're going into. Some things will be easy that we can change relatively quickly, but some things around service improvement and changing the patient pathway will be a longer-term thing. So we can see this happening year on year and making sure that we're constantly sticking to our goals. Even though we've got challenging times around efficiency, I think it's really important that we focus on the investments that we've made as an organisation. So we've recently invested in frontline staffing, so the board's been really supportive around that. We've got fantastic opportunity around the new cancer development that board's recently approved as well. And so I think it's really important that we focus on what we can do for the population and the improvements that we can make. The other exciting thing is around working in partnership with some of our local stakeholders. So we're increasingly now working in partnership with others to just improve and make sure that we can use every pound that comes into the health service in the most efficient and effective way. One of the stands here today is manned by the finance team, so I hope you spend time and visit the stand today. One really important thing that we've got involved in as an organisation is the Future Focus Finance initiative. So we've been really lucky to be a pilot site in taking that forward. One of the things that I'd like you to look at, if you could do, is around being a value maker. So we're looking for people outside of the finance profession to become involved in being a value maker and just make a pledge in terms of what you can do to improve the patient experience.
Hello, my name is Tracy Kearney and I am on secondment to the Choices team as Improvement and Innovation Manager. I was previously working as Performance Manager for the Medicine and Emergency Care Division. I understand the frustration felt on the shop floor by all levels of staff and wanted to take the opportunity to improve my skills to enable me to support the staff in bringing ideas to fruition. My role involves staff engagement within the Trust, and I've been very impressed with the level of enthusiasm throughout staff groups in relation to improving processes, which in turn leads to improved patient care and sometimes efficiency savings too. I speak regularly with the service improvement leads within divisions, and this helps to know what is happening in all areas and helps to keep everything joined up.
I'm Gail Collins, I'm the Medical Director here at Chesterfield Royal Hospital. I think thinking about things that we've achieved over the last year, particularly I'm proud of what we've done in the Medicine and Emergency Care Division, where we've put in place some changes that have enabled patients to move more quickly through a pathway when they're admitted on an unplanned basis. So patients who are admitted urgently when they're unwell are seen very soon by a senior member of staff, usually a consultant in our emergency management unit, and that consultant will set a detailed treatment plan which dictates the course of that patient's care over their subsequent stay with us. What this means is that patients start treatment really early on after they've arrived in the hospital, and that gets to the crux of their problem quite quickly, and the main benefit is that patients' length of time they spend with us in the hospital is much reduced. shortening the pathway for patients and reducing their length of stay in hospital is that actually we need less capacity in the hospital to care for all the patients who present to us. And what has happened this year is by improving our efficiency, by setting treatment plans early in the course of the patient's stay, reviewing the patients very regularly, having available therapists and pharmacists to support the care of these patients, we have been able to reduce the number of beds that we need in the hospital for patients, and in fact we were able to actually close a ward, which has enabled us to increase the levels of staffing in our other wards so that we can really provide this more intensive input to patients and for their benefit.
Hello, my name's Rob Freer. I'm the Service Improvement Lead for the Medicine and Emergency Care Division, and I've been in post just coming up a year now. Been quite a few things going on. We've been some big changes with the frailty unit, and we've managed to get some big projects through involving dementia care. We're currently looking at trying to get IV antibiotics dispensed outside of the hospital. And there's a lot of really hard work going on in the backgrounds that I think a lot of people don't see, trying to improve things for everybody. I think it's really important that we need to start working with our partners outside the Trust. We have a few examples like the Rapid Response Team, which is coming in as part of the winter resilience measures. This is going to be a multidisciplinary team based next to the Discharge Lounge, which is going to help patients flow through the hospital better when they've come in following a fall. And this is going to be in partnership with DCHS. We're also doing some work with the OPAT service with the Rapid Response Team, again based at Walton Hospital. And I think really this is the future. We need to start working together and joining things up. We're really looking forward to seeing you today at today's event, celebrating our success over the past year. It's important to realise that there are lots of things going on. People are coming up with good ideas, projects are getting pushed forward, and this is all part of the challenge that we face in the future with the restricted funding and the increased quality of care that we need to offer. As well as being the Service Improvement Lead, I am also a change agent for the Trust. There's a lot of us in the organisation at the moment. There's a real good feeling between us all. We're all keen to get things moving and to improve quality of services for our patients and to improve the working lives of our staff. If you're interested in finding out about change agents, please come along and ask one of them, and we'd be really pleased to tell you about it.
Hi, I'm Stuart Ellis and I lead the Transformation and Choices programme at the Trust. We're at a critical junction in a journey as we have to keep adapting and accelerating our approach to change to meet the needs of our patients, staff, our health and social care partners we work with. I think we're all starting to understand the scale of the challenge the NHS and therefore Chesterfield faces. How do we keep pace with what people rightly expect from us, providing timely, safe and appropriate care, at the same time living within our financial constraints, meeting the current and future workforce challenges we face and sustaining care for an increasingly ageing and complex population. As well as our family and friends, we ourselves may one day be patients of this hospital. Many of you may have been already. Our challenge is to ensure we can continue to deliver our patients and our own expectations, shaping the hospital over the next 5 years to be the very model of what a district general hospital should be, ensuring it's fit for purpose for the next generation of the NHS. Not just a few, but hundreds of you have started to join this challenge over the last couple of years. Many teams have been making changes, big and small, to improve services while balancing the three challenges of quality, efficiency and service delivery. The Choices programme continues to support this work that's been led by divisions, continuing to train change agents, starting the introduction to change programme for frontline staff and developing our clinical leaders change programme in 2015. All aimed at ensuring staff are equipped with the skills to meet the transformation challenge. For me personally, it's really important there's a chance for a stop moment in our busy day-to-day roles to share and reflect on the work that's taking place in teams across the Trust. That's what celebrating our success is about for me. A brief time to share the learning in the Trust, make new contacts with teams you can learn from, as many of you did last year, and understand how you can continue to support and take on this challenge going forwards. Delivering the scale of transformation and change we need is increasingly going to drive the scale and pace of some of these changes, but we need to do the small things too. Hopefully, as you go around the displays and talk to other teams, it'll inspire you to make your own changes, however small, and support your teams in achieving the bigger challenges ahead. It's not about the few of us on these videos. We can't deliver this without the other 3,500 of you. Myself and others around the Trust can help, but my challenge to you is, what are you going to do to make next year's care even better for a patient that you can then share with us in the future?